Chairpersons, please felicitate our speaker.
Good morning, everyone. It's giving me immense pleasure to introduce our head of department, Dr. Yashwant Rao. I am from this department. I am professor here. Yashwant Rao doesn't need any introduction. He is a very good-hearted person, despite of a good acquisition, lots of research work. I request all the respected seniors which are here present to kindly come and see our Department of Pediatrics, which has been taken to a great height under the headship of our Dr. Yashwant Rao. We are running the largest PICU in the UP state, 33 bedded, even larger than the KGMU. We are running one of the largest NICU, having a least mortality rate in the state. So I highly appreciate if you all seniors please come and see our department, what height we has been taken this department in the last few years. Thank you. I request sir, please kindly follow.
Thank you, Dr. Sailendra, Handa sir, Suti ma'am. Respected seniors, for me it's an opportunity to be in front of you as a speaker. I am not a speaker. आपके द्वारा ही सिखाया हूँ, किसी ने मार के सिखाया, किसी ने प्यार से सिखाया। मैं पूरे पैरा को तहे दिल से धन्यवाद देता हूँ और मैं सबके सामने 3 नंबरी और 7 नंबरी लगाना चाहता हूँ। सर वो आप लोग लगवा देंगे तो लगा लूँगा। सर पर्स लेके नहीं आया हूँ, सर सही में पर्स लेके नहीं आया हूँ। हंडा सर 13 नंबरी लगवाऊंगा, बोहनी हो जाएगी। Sir, it's not a talk. Initially, I joined the department in year 2006. So before that, research work was almost zero in the GSVM Medical College, Kanpur. So I did my MD from KGMU, Lucknow. So we started doing a small project, ICMR funded project. Now we are getting very big project from the ICMR. WHO, we are doing the project from the WHO on PSBI, possible serious bacterial infection, and this is the part of my project running in the Department of Pediatrics, funded by the ICMR, 50 lakh project, and we are running this project since 2 years. So I am sharing the data which we get from our project. Before starting the title, I would like to say that in our country, severe acute malnutrition, basically babies who are very thin, lean, thin and stunted are quite high. And in spite of all the therapies, all the treatment provided by the government, data are not reducing. We are just managing the data, not doing anything. So we got the project, and WHO guideline is severe acute malnutrition should be managed either at the community level if there is no complication. But if there is complication, they should be admitted and they should be managed. So babies who are at the community level cannot be admitted, they are okay. Guidelines are use antibiotic in each and every baby. We put the project in ICMR, why to give antibiotic unnecessarily if there is no need of any antibiotic. The topic is randomized control. We did the randomized control trial in the community basis to know the outcome if we don't give the antibiotic to uncomplicated severe acute malnutrition child. This is the project sanctioned by the ICMR. Few important data, we should be data are very mind-blowing type. In India, 33 lakh children are malnourished, out of which 50% of severe acute malnutrition and 50% are moderate acute malnutrition. We are worse than Pakistan, you know. We are worse than Pakistan. And to know the nutritional status in any country, very important parameter is global hunger index. And there are the 4 parameters: undernourishment, child stunting, child wasting, and under 5 mortality. And this survey, global hunger index survey, was done in 150 countries, and our country, India, is 116th. मतलब 150 कंट्री में हम 116वें नंबर पे हैं, एंड हम कह रहे हैं कि हम बहुत आगे बढ़ रहे हैं. We are playing just with the data. just with the data. Second thing, in year 2021, we were at 101. In year 2022, we are at 107. Even Pakistan is better than us. The burden of the severe acute malnutrition, according to the NFHS data, 1/3 of children are under 5 are stunted. 1/3 is stunted in our country, and 1/3 is underweight, and about 20% are wasted. So we conducted the study, community-based management of severe acute malnutrition. Children's age should be between 6 months to 59 months, means ki up to 5 years. In the community, we have to do the appetite test. If appetite test is the mixture of the diet, if child start taking that diet, it means ki appetite test is passed. Means ki that child will be managed at the community by the government, and they should have no sign and symptom suggestive of any complication, has a reliable caretaker who can provide the treatment, who can give the nutrition, and is able to return on feeding center during follow-up. Key component were provision of the therapeutic diet, regular follow-up at home in the decentralized healthcare center. As per WHO guideline, this is very important because our department is challenging the WHO guideline, and this guideline is followed by Government of India. So we are challenging that guideline by this study. As per WHO guideline, antibiotic amoxicillin must be given to every patient of the SAN, whether he is eating or not eating, we have to give on outpatient basis for 7 days. Sir, 33 lakh children are there, they are going to receive antibiotic without any cause. Why? Because WHO is saying, because we don't have our own data in our country, we are just following the guideline, cut paste guideline, and we make it deliver to the community level. No. So we have did this study. Innovative use of the antibiotic, because this amoxicillin is used for pneumonia, possible serious bacterial infection. How much innovative use of antibiotic is there in our country? With reference to the concept of antibiotic stewardship, we conducted a pilot study in the community. We have chosen 10 patients, and we don't give the antibiotic. All the 10 patients were become normal without any adverse effect. This came an idea ki why to give antibiotic. So our objective was to assess the clinical outcome of management of uncomplicated severe acute malnutrition at community level with antibiotic and without antibiotic. This is the material and method. I am not going to the detail. Study design. Detail of the SAM children were age group between 6 months to 5 years, weight for height less than 3 standard deviation, bilateral pedal edema, and mid upper arm circumference less than 11.5. So we have chosen the SAM child in the community. We divided in the 2 group, control and intervention group. In each group there were the 50 children. In control group, we are following the guideline of WHO, same guideline, we are giving the antibiotic amoxicillin, and in the intervention group, we don't give any antibiotic, just follow other guidelines, but antibiotic not given. Now see the outcome. We followed, and results are, most of the children included in the study in both antibiotic and without antibiotic were from lower middle, because in any RCT, both the groups should be similar. So they were similar in demographic, clinical demographic profile, age group, age wise, sex wise, both were similar in control group, and out of these complications were the same. Diarrhea, admission were same in both the group, both in control and intervention group. These are the outcome, because outcome is in Z score, जो कि अभी भी मेरे समझ में थोड़ी कम आती है, community medicine वालों से contact करना पड़ता है. But you can see we have control group and intervention group. Weight for age, weight for height for age, and weight for height were similar in both the group when we started the study. After 2 weeks of the follow-up, we did this, and after 2 weeks, results were weight for age, height for age and weight for height were similar. You can see the p-value were not significant. Means कि after 2 weeks of the follow-up, there was no difference either in the control group or in the intervention group. Means whether you give antibiotic or you don't give antibiotic, results were similar. So why to give antibiotic? This is the comparison from baseline. You can see baseline Z score were 0.97 and after 2 weeks 0.82. So there was the significant, means ki in control group where we given the antibiotic, p-value were significant, means after 2 weeks there was increase in weight, there was increase in, but no increase in the height, because in 2 weeks height will not increase. In intervention group same result were there, means whether we give antibiotic or we don't give antibiotic, results are similar. So discussion is, in this randomized control trial we found that routine use of amoxicillin was not superior to the placebo for nutritional recovery in children with uncomplicated severe acute malnutrition. This finding challenges both WHO and Government of India guideline that support continued use of broad spectrum antibiotic. So conclusion is, in this study, optimize the use of antibiotic in uncomplicated SAM at community level. A randomized control trial was conducted and all the protocols laid by the Governing Institute for Management of SAM patients were followed. It was concluded that antibiotic is not needed at all until unless child is having some sort. Thank you. Any comment? Thank you, sir. And sir, we have sent this paper to IJP and it is almost going to be published. One more query was there. They are going to publish it. So hopefully we will write it to the Government of India to change our guidelines.
Your sample size should have been little bigger.
Sir, actually, it's a 3-year study. It's a 3-year study. So still we have completed only 1.5 years. So sample size is 400 in both group.
Yeah, then it will be more challenging.
Yes, sir. Yes, sir. We are doing that.
WHO is doing marketing.
Yes, sir.
This we have understand in the COVID era.
Yes.
Hello.
Comment, sir.
Thank you so much, Dr. Yashwant, for
Thank you, sir.
delivering such a beautiful talks and also informative that is new trends is going on. We have to use or minimize the use of antibiotics in these newborns or pediatric age groups because these antibodies not only provide harm but also prolongs the duration of hospital stay also. Sometimes
Yes, sir.
these antibiotics produces the lethal complications which is very difficult to treat.
Yes.
So it's going very nice that we are using these antibiotics in very minimal or no antibiotic therapies. We have to use antibiotics when we have concrete supports of pathology,
Infection.
clinical investigations, and also whether these antibiotics are suitable for baby or not. Thank you so much.
Thank you, sir.